Thank you once again for the invite. I'm very
All right.
grateful. My name is Mrs. I'm also a nurse. Mrs. Confidence C. Francis Edozuno.
Okay.
Yeah, I'm a nurse, a graduate nurse from University of Ibadan. Married, Mrs. Yeah, I'm married with a kid.
Glory.
I'm married with a kid, and what else about me? Uh, I'm currently doing my NYSC. So I'm from
Wow,
the eastern
congrats.
part of Nigeria. I think if I should add
Okay.
Anambra to be precise. So I think basically that's it.
Thank you so much. Thank you. We are grateful again for having you here. And this like so much of a motivation. So it doesn't even matter. I can get married in school and still do well. It's about the zeal, right? The perseverance.
Yeah, it's actually possible, but for my case, it doesn't really like that. I got married after school.
Oh,
that was last year.
Okay.
Okay, well, in 2022, that was 2020, not last year, last 2 years. But because of the lockdown, there was this space. So I finished my defense in February 2020. So because of the lockdown, couldn't really complete the whole thing, like senior sitting on the exams and all. So I got married
that's true.
November 2020 yet.
Do you feel nurses in Nigeria work a lot?
Yes. I believe,
right.
Not just a feeling, I do believe that nurses in Nigeria work a lot. Why I believe they work a lot is because when you want to define working a lot, you relate it to appreciation, relate it to the remuneration, like how much they are being paid. There's an amount to be paid, and because of what you are being paid, it's what the work. But in the case of nurses, the opposite is the case. So from the level of you being a registered nurse from nursing or a degree nurse to a youth service corps nurse to even being a staff nurse, nurses levels they actually work below their pay. So I feel they work a lot.
Okay, what can we do? Is it that we have few nurses compared to the work, or that we have many nurses, but not everybody? I don't know. Do you know how we can solve this kind of issue?
The issue is all about value, if you ask me. There's virtually little or no centers. I don't make use of the term no. Even if you go down to the grassroots of a healthcare center in a typical village, one common thing you will see there, at least you will see a nurse. If you don't see a lab scientist, you don't see a pharmacist, you don't see a technician, lab technician, or a doctor, what have you, you will see a nurse. That just shows how vital nurses are in the healthcare system. But when it comes to issue of them being recognized for their services or an issue of them being appreciated in terms of their salary, you don't see it. So for me to tackle the issue, it's way back to the background. It's not just something that is on the surface.
Okay.
Back to the background, back to the people who are so-called anchors, people who are stakeholders in the profession, people who are in the places of decision making and what have you. Those are the people who had value. Yes, people that have the say, people that have the what have you, those that make decisions for nursing as a profession. Those are the people who have set a background of the value for nurses. If you're in a working setting and you're the chief nursing officer, the head of your department, is sending you to do something that is not in the line of your duty because of a medical doctor or any other health personnel, you just can't help it. Even if you know you're right, but your boss sees she's like a slave or she doesn't know her own rights. And because of that, you just lose the value you have.
Okay.
And When it now comes to remuneration, take for example now, if I'm not mistaken, I think there was a circular released by Nursing Council talking about the placement for graduate nurses after graduation. That was just a written circular. Come to practice, come to the real labor market. As a graduate nurse, you're graduating, you're to start working. Starting on NO2, where I am right now, you're starting on NO2. The only difference is starting on a different step compared to someone who finished from School of Nursing. And who are those people fighting this? These are those same people on the top, or guys at the top in quotes. So I think to adjust this whole thing, it's just the best solution is let those at the top be modified. Let the young blood go up.
Look into it.
Because everything we've achieved so far in nursing is because the young people fought for it. As a graduate nurse, you can tell that it's because some group of young persons fought for our internship. That is why we have it now. And despite that, some elderly people up there are still saying the money that are paying them is too much. Whereas you have other people, pharmacists, medical doctors, we'll be collecting more than that. But you go and kill yourself doing an internship. I don't know if you're getting. So those other people are still fighting. How will you just graduate not 100 and something thousand? It's too much. But you have mates that are collecting close to 200. So usually with the top, there need to be some screening. Let them just and allow the blood.
Honestly, because when you go to the hospital, actually, they are doing a lot. Actually, so honestly, I don't know, but it is a thumbs up to all nurses out there. And if you go to villages, truly, most times you find nurses everywhere. Nurses, especially, they are usually the ones that they put everywhere. You can easily access them. They are usually everywhere working. So well done, thank you.
Thank you.
But even at that, like
just note, it's not a bias to our fellow professional colleagues. They are doing well and they are enjoying the profession because people have fought for it.
Yeah.
So those in nursing, fight for us, we also enjoy it. I really don't have any bias with them. Like some people have paid the sacrifice, but in our case, people are not willing to pay the sacrifice. So I just hope we get to that level.
Okay.
Just separate sacrifice.
Yeah, I get. But what's the interesting part of this this profession? Like for people now that want to, because someone like my niece, I want to be a nurse. All this, like, what's the interesting part? What exactly can you tell them? And they will be like, yeah, this nursing, I must get it. Something like that.
Okay. If I would say something about that, I think most of the reasons I've seen now why people are interested in doing nursing, it's the whole travel abroad thing.
Okay.
Because actually, to be on the more serious note, it's the whole travel abroad.
On a serious note, exactly.
It's just the license, the shortest cut. There's something like that. So just So, but I think anybody coming to the profession should to japa hair, one more japa, just leave. Let's go. So, but I think if anybody's planning to come into the profession, you should really consider liking what he or she's doing and have a passion for it. Because this whole thing is not going to always hold your interest.
Actually, especially since it has to do with human beings. Yeah. Like, I know somebody that I feel this person is wicked though, and she wants to study nursing. Sometimes I'll be like, is this how you want to study this nursing? Is this how you want to study this nursing? So, but then basically, I mean, nursing is a course that is enjoyable. It's enjoyable. And what's up with this bias of it? It's as if nursing is for girls or something. What do you have to say about this kind of thing? It's as if it's girls that just go for nursing. And then maybe the males will start going for pharmacy, other courses, something like that.
Okay, actually, it's something that is, you can see it almost every part of the country.
Yes. Yes.
What I think is the foundation of those
Mm.
courses. I do make a joke with my friends and I tell them that Nightingale is our problem. Yes,
What?
because nothing is kind of Nightingale is our problem. I do tell my friends that
Okay,
Nightingale is
okay.
our problem. Any problem that you want to relate to nurses, you can date it back to Nightingale. That's just the truth.
Yes.
So because of that
Yes.
female nature of the founders of nurses, check all your foundation of nurses, check all the theories, Sister Calista all, Sister this,
Yes,
Nightingale
yes,
this,
yes,
or
yes,
all those are
yes.
mainly
Actually.
females. So you can't, males then don't come into the nursing profession. Nurse, they see it like the role of a mother. As a
Yes.
mother nurses a child.
Yeah, actually.
So but with the whole gender equality and what have you, we now have males coming into the nursing profession. And trust me, the few males I've seen in this profession, they are good. When you see a male nurse, you can really say this nurse is a good nurse. Most of them are really good in
Wow.
doing their job, in relating
Wow.
with subordinates and all. So the thing is, they should just let go of the bias. If it's something you want to do it. If you're the care, it's more like an avenue for you to care better.
Okay.
So I think that's just the way I see it.
Please, how were you able to avoid distractions in school?
Okay, you said how was I able to avoid distractions in school?
Yes.
The major, this first word that I can use to describe it is discipline. I think that's the word, discipline. There's a lot of distraction in university, of course. You have
Yeah, actually.
a lot. I can't even say because I wasn't really involved in them. But one of the things that helped me is, well, my background. I grew up to be a girl that I wasn't really necessarily exposed to much social life. You go for parties, what have you, all those stuff. I was more like I go to church kind of girl. I go to church, I go to
Yeah.
work, school, stuff like that. So just the things you really need to do. I do things like I watch movie at home for fun.
Yeah.
So because of that kind of upbringing, because of that kind of lifestyle, I was not necessarily exposed to that part of school. Not because I don't know they exist, but there was already a mindset of I want to go to school and study and be the best. And because of that, I just didn't want to get to know about it. Most times, what affects people is
Yeah.
these things are exposed to them at home. But you already have this mindset of when I get to school, I'll try and find out what and what is the event, what is happening. The funniest part is till I got to final year, my final year, that I got to know that some things actually exist in my school. Other things that were actually even helpful, not necessarily distracting. Like I was just I was shut out. I shut out some of this information so that I won't even be tempted at all. So I think
To
this
do
one
it.
was yes. I think that's
Okay.
basically like it. And then I
Okay.
got
What of time management? Ma, please can you repeat the last part?
I say and then I got busy with things I want to do. So there's no
Okay.
free time to just be thinking about something else.
That's unnecessary. All
Yes.
right. But what of time management, please? How do you break down your time?
Okay. Let me start by confessing that I'm not the timetable kind of person.
Wow.
You know all those type people write the timetable,
To-do list.
to-do list,
Mark
have
what you want
some
to do.
I'm not like my friend that has all those sticky notes and what have you. I'm not really that kind of a person. Uh Usually what I do is I plan my day.
Okay.
So usually what I do is that at the start of the day, during the course of my quiet time, I hand over my day to God and then I have an intention about, I have in my mind, sorry, what I want to do for that day. And I just set up those goals in my mind, like, okay, 1, 2, 3, I'm going to class. I'm thinking of daily goals, not just the whole big damn thing. Thinking of daily goals, okay, let's say it's the Monday, I have lectures from, let me say, 8 to 4 or 5. From there, I go to church. My day is just like that. But now, in the
Okay.
course of the day, maybe between the 8 to 5 class, you might have some assignments. So once the assignment maybe is given, I tell myself, okay, once I'm back from church, I'll make sure I do that assignment before I sleep. So
Yeah.
it's up to me. Even if I stay in church after service, I gist with my friends. Let me say I gist 9, 10. Because I've told myself I have to do that. I'll make sure I do that before I sleep. But if it happens that I'm tired, it will not be wise of me that day to stay back at church. I have to
Yeah.
leave early so that I can get back and do what I have to do before I sleep. So there's this kind of, if I don't do what I have, I still apply it to my day-to-day life now, even as a mother. I have things I intend to do for a day, and I make sure I try and do it. Sometimes my husband will be like, oh yeah, go and rest, go and rest. But there's this mentality that if I don't finish that thing I've already structured my mind to do, no matter how tired I am, I won't be okay. I can't just go and rest. I am this kind of person, just do the work. When you are done with the work, you can take all the rest you want. So that's why I focus on stuff like that.
Wow. Myself, I'm learning a lot to go and apply in my life. Because I've been trying out to-do list, but it seems I used to, in fact, at night they said you come and tick the one you have done, and I find out that I'll forget I wrote something. It's like after 2 days I'll see, oh, I wrote these things, I even forgot I wrote. I'll just go out, and what's in my mind is to do what's in my mind, not really what I wrote down. So actually it's about knowing yourself, right? Knowing
Yes.
what's working for you.
Yes.
All right, thank you so much. Okay, like last words for nursing students and even those that are already nurses or those that are aspiring to be nurses.
Okay. All right, let me start with those who are aspiring to be nurses.
Okay.
For those of you who are aspiring to be nurses, nursing is a wonderful profession, I must say. And I'm always proud to be a nurse. Forget about all the Nigerian problems. I'm actually proud to be a nurse. Whenever I'm opportune
Yeah.
to do my nursing job, I do with the best of my abilities. I make sure my patients enjoy my services. So nursing is a profession whereby you can touch lives with just a smile.
Wow.
With just
Ah,
a smile. That's just as simple as that. And
yes.
so I can tell you that truly it works. I've had patients coming into the clinic and I'll be like, hey, welcome, good afternoon, please have your seat. And this will be like, wow, have I seen you before? I just like the attending. Like I'll just as simple as like whatever the person has been bothered about, that approach helps them.
Yeah. Yeah.
So okay, can I continue?
Yes, yes, please.
Just come in with the mindset of being the best you can be.
Okay.
Whether you chose nursing or nursing chose you, or you were forced into nursing, or Nigerian economy made you enter nursing, just desire to be the best. I said if you're a snail eater, eat snail big one, so that when you're called a snail eater, you'll be proud. For those of you
Yes,
who are
yes.
already in the profession because of learning, those of you already in the profession that are learning how to be nurses, give it your best
Yeah.
shot. Be open-minded. Let me tell you the truth. There are a lot of things that you will hear from your colleagues, from maybe your teachers, that will make you enter into the profession with a biased mind as a student.
Yeah.
Take for example, while I was in my nursing program, I had a teacher back then in School of Nursing. there's this hatred, let me put it that way. There's this kind of hatred for medical doctors. And it's born out of the fact that many nurses slave themselves and don't value themselves. So he was not happy about it and was always pushing it to us. Don't allow the doctor to do your shit. Don't allow the doctor to do this. What have you? And many people got hooked up in all these things. So the time I realized that if you allow yourself to get caught up in all those stuff, you won't render your services effectively as a nurse, and you just keep on piling problems for yourself. Because when I had a misunderstanding with a consultant for no reason. He actually did me nothing, but I was kind of apprehensive, and but then I realized that if you do your work well, that's the truth. If you do your work well, you study hard as a nursing student. Know the nursing. Some of you guys just say, but let me just pass. My pass here. Let me just pass and go. Know the nursing. Know what they are teaching you. Know it.
Yes.
Have this critical mindset. Let me tell you, these doctors, guys, they know those that know book.
Yeah.
Because I know doctors are usually like one of the challenges nurses say they have. But I tell them, doctors are not your problem. You are your own problem. That's just the truth. Do your work well. Don't look down on anybody. Forget about being a doctor or nurse. He's a human being. Don't disrespect another human being. That's why I look at it.
Yes.
I'm not greeting you good morning because you're a doctor. I'm greeting you good morning
because you're another human
if
being.
I meet you on the road, I will greet you good morning. I don't think so. You don't need to put up those up front of you will not greet him. Why will I greet him? Why will he send me message? Why will he send me message?
Yes.
So I don't see things that way. And I can tell you sincerely, throughout my career, I entered the nursing profession since as a student first in 2011. From that 2011 up until now, I've not had any doctor say shit to me. Not once. It was even me that wanted to look for forgotten trouble. And at the end of the day, we became friends. So like no one had, because I do my work. If you are doing your work as a doctor and you're not doing it well, I will
Yeah,
so
exactly.
I will approach you and like tell you, hey, with respect. Take for example, let me just give you. I'm just talking to those in the nursing school and I think it also span with those in the profession.
Yes.
Because these are some of the things that make nurses not to enjoy their work. Do your thing. Don't encroach. And if they encroach, because they do that a lot, most time doctors encroach into nurses' affairs. We study mental health in university and even in school of nursing as nurses, psychiatry, as nurses to understand people. We even do human behavior and illness. Some schools offer human behavior and illness. We study psychology. These are courses that we do as nurses that should give us upper hand over some of all these other health professionals.
Okay.
A doctor comes and encroach into your affairs as a nurse, maybe as a student or as a staff, and is trying to lord over what you know is not his jurisdiction. Wisdom and understanding of mental health, psychology, and human behavior let you know that there is an egoistic part of being a medical doctor. It just happens. I don't know how it happens, but from my observation, I've noticed there is an egoistic part of them. It's the same ego that works in the man as a husband in the house. If you meet every man has an ego in them. And then let's assume nursing, medicine, and other professionals are like family. I would say the doctors are the husband, the nurses are the wives, other professionals are the children and relatives.
Yes,
so
yes.
You know the way you're a man, we want to sometimes show you that he's a man. It's the same way it comes into play with them. And what I do in cases like that is I don't put it up at you at that point. When you now start saying this is the issue we have, and who suffers? The patients suffers. So someone like me, give the person the space, and then you trash it. It's not actually easy for you not to take stuff, and it's not, although it's not right, but in situations like that, instead of you attacking, in the front of the patient and relatives. It's just an uproar. It's something that you draw the guy to the side between both of you. And let me tell you, this thing I'm even saying, it doesn't happen when you do your work well. When you have your own self-value. I'm only saying this because I've seen this play out in people's cases.
Okay.
For me, I've never had that kind of situation.
Yeah.
Sometimes if it's how you will do your work, that they themselves, they know that this nurse know what she they do, no mess up. When you're on duty, they too, their toes are tight. They don't want to make any mistake in prescription because they know that you will fish it out and you will come gently. You're not trying to tell them to insult them. You're trying to tell them that, I beg, so you know, vessel, this is the way you write. I know so you for a mistake you've been do, just self correct time, I beg. You get, and no, just like that's just what I feel. Other people have their reason. They may say you may not be assertive or what have you, but I still believe there's a part of understanding. You will enjoy your work as a nurse. Your patients will enjoy your work, and then other health professionals will enjoy working with you. As a nurse, you're like a mother. That's one of the reasons why I love nursing. So to wrap it up, I just feel nursing is a great profession. I'm proud to be a nurse.
How?
I'm really proud to be a nurse. So as men that are ready to come into the profession, it's a good one. Forget about all the problems. Just do your work. And if you want to go to the abroad, as we call it, it's also a good one. Yeah, it's also a good one. I won't say I'm not fostering for people to go. It's their choice. Everybody have what they want to do. Although me, I have the line that I want to tell, the path I want to run.
Yeah.
But it's still up to you. But it's a good one.
Thank you so much. Like, thank you so much. Personally, I enjoyed this interview a whole lot. I enjoyed you here. I enjoyed your stay here. Please, what's in your mind? We'd like to hear from you too, actually. We'd like to hear from you. Make use of the comment section and then subscribe to this channel. Turn on your notification. You can see something like a bell down there. Please click on it, turn on your notification, and share this as much as possible. Let people hear about it. Let people know that these people are doing a lot and there's a place for change. And let them also know, or maybe let doctors also know that this is your boundary, as you have said. So thank you for watching. We are grateful.